Hi everyone. I hope you all are doing very well. And before moving on to our session, I would like to take a moment to introduce myself. Myself, Dr. Sri Parvati, and I'm talking on behalf of DK Ayurveda. And the goal of our class is to equip you with the fundamentals or basics of the Shalya-demo. And without wasting your valuable time, we can dive into our topic. Okay. Today we are going to discuss one of the most important topic of the Shalya-demo, that is Vrinashobha. We can correlate this with the inflammation in modern practice. So many questions are frequently asking in various board exams. Okay. And the textual reference of the Vrinashobha are taken from Sushruta Sutra, Sthana, 17th chapter, Amapakveshaniyam. And from Charaka Chikitsa, 12th chapter, and also from Madhava Nidana. Okay. And uh, I hope the slide is visible to all of you, and we can move on to the contents. First, the definition is mentioned, and then the classification, stages of Pranashobha, Chikitsa, important yogas, and complications. If a question is asked to define Vranashobha and its classification, so and define Vranashobhas, in this case, you can include all these topics there. Okay, and some of the previous questions asked in the course exams are detailed here. And next is we can move on to the topic directly. Okay, first is definition. Shobha samudhana grandhi vidradi allergy prabhradeha prayena vyadhiyo abhida anekakradhaya tair vilakshana pridugraditaha samo vishamova tong mamsasthai sharira स्वमांसस्थायी दोष संगादः शरीरे एकदेशोत्थितः शोभ इत्युच्यते. Okay, that is various disease like grandhi, vidradi, allergy, etc. have shobha in their initial stage, or they generally arise with the shobha. And apart from this, a different type of inflammation or shobha is there, and the characteristics are that they will be thick or elevated mass that may be even or uneven and residing in the skin and muscles, that is in between skin and the muscles, and all these vitiated doshas will accumulate into one part of the body specifically, and these will be the characteristics of the Vrinashobha. And now moving on to the types of Vrinashobha, there are 6 types of Vrinashobha. The Shadvido, Vada, Pitta, Kapha, Kapha, Shonida, Sannipada, Agandu, Nimitta. There Vadaja, 6 types are there: Vadam, Pittam, Kapham, Shonidaja, Sannipada, and Aganduja. Then we can move on to the features of different types of the Pranashobha. First one is Vadashobha. Tatra Vadashobha, Krishno, Arunova, Parusho, Mrudu, Anavastida, Todadeshchatra, Vedana Vishesha Bhavanti. That is the swelling produced by aggravated Vada. The features are that will be either black or light red in color, and that may be rough or soft, unsteady. The unsteady pain is like pricking pain. And next is Pittaja Shobha. And Pitta Shobha, Pido, Mrudu, Sarekto, Shikranusari, Oshadeshchatra, Vedana Vishesha Bhavanti. And the feature and the type of the pain will be Osha, and the color may be yellow or red color. Then the nature will be very soft swelling, and it will be quickly progressing. That is Shikranusari. Okay, next is Kabaja Shobha. And in case of Kabaja, Shleshma Shvedu, Pandu, Kadinaha, Snigdha Shido, Mandanusari, Kandwadeshade, Vedana Vishesha Bhavanti. And the Vedana Vishesha of the Kapha Shobha, that will be Kandwadi, etc. Kandwadi, and color will be Pandu, and the nature of the swelling, that will be Kadina, Snigdha, Shido, and that will be Mandanusari. In case of Pitta, that will be Shikranusari. In case of Kaba, that will be Mandanusari. Okay. Next is Rektaja Shobha. Rektaja Shobha, the features are similar to that of Pittaja Shobha, and it will be Adi Krishna, that is excess blackish discoloration will be seen in Rektaja Shobha, that is Pittava Shonidajo Adi Krishna. Next is Sannipadaja Shobha. Here Sarva Varna Vedana Sannipada Shvedavaha. In case of Sannipada Shvedu, all the three colors of the Shobha and all the three types of Vedana will be there in case of Sannipadaja Shobha. And next is Aganduja Shobha. In Aganduja Shobha, Pitta Rekta Lakshana, Agandur Lohidava Bhasasya, that is Pitta Rekta Lakshanas. The feature similar to that of Pitta Shobha and Rekta Shobha will be there, and Lohidava Bhasa is the extra symptom mentioned here. Naganda Shobha, Lohidava Bhasa is mentioned, and otherwise Pitta and Rekta symptoms will be there. This is a tabular form of the different types of Shobha. You can go through this table. This is the examples of Vadaja Shobha, Vadaja, Pittaja, etc. Shobha. In case of Vadaja Shobha, we can understand this from the color, that is blackish discoloration is seen in the Vadaja, that is Rekta or Aruna Varma, Krishna or Aruna Varma seen in the Vadaja Shobha. In case of Pittaja, that is slight reddish discoloration is in here, Kabaja Shobha, and in Rektaja Shobha, Adi Rektada, that Adi Krishnada, that is seen here. Next, moving on to the stages of the Vrana Shobha, and the stages of Vrana Shobha are mainly three types. All the stages of the Vrana Shobha are not present in every cases. In Amavasa, in some cases, the Shobha will subside even in the Amavasta itself. And if the proper Ahara Vihara is not continuing, or otherwise, if you are not doing the proper treatment, that may lead to the further stages, that is Pachimanavastha and Pakvavastha. Okay, we can move on to different stages. First one is Amashobha. Tatra Manda Ushmada, Twak Savarnada, Shida Shobhada, Styrium, Manda Vedanada, Alpa Shobhada, cha Amalakshanas, Muddishtam. We can see all these are the features of the Ama. Mild temperature, Manda Shobham. Color will be same as that of the skin itself. And swelling is being called to touch, that is Shidada, and that is immovable. And mild pain and slight swelling will be seen in Amashobha Vasta. And in case of Pachimana Avastha, the different types of pain are mentioned here. That is, severity of the pain are mentioned here in the Pachimana Shobhavastha. That is, Suji Pirivadi Studyade, Deshyadevi Pipilikabihi, Tabhisha Samsarpyadaiva, Chidyadaiva Shastrena, Hidyadaiva Shaktibihi, Tadyadaiva Dendena, Pidyadaiva Panina, Katyadaiva Cha Angulya, Dehyade Pachyade, Ivacha Apniksharakhyam, Oshachosha Paridahascha Bhavanti. Vrishchika Vidya Ivacha Sthanasana Shayaneshu Na Shanti Mupaidi. Atmada Vastiriva Adadasha Shobho Bhavadi. Tvakvaivarnyam Shobha Bivriddhi Jwara Daha Pipasa Bhakta Arujishta Pachyamana Lingam. These are the features of the Pachimana Shobha, and different types of pain are mentioned here. And the person does not find comfort in sitting, lying or sleeping, as for being sting by scorpion. And a swelling resemble like a bag distended by air, and this can be felt by the fingers of the examiner. And a change of the color of the skin will be noted in this stage, and swelling will be increasing in the size, and burning sensation, fever, thirst, loss of appetite. All these features are seen in the second stage, that is the Pachimana Avastha. And the final and last stage is Pakva Avastha. Here, Vedana Upashanti, Panduda, Alpashobhada, Vali Pradurbhava, Tok Paribudanam, Nimna Darshana Mangulya, Avapidide Pratyunnamanam, Basta Viva Udaga Sancharanam Puyesam, Prabidayet Yega Manda Mande, Chavapidide, Muhur Muhurtodaha, Kandur, Unnadada, Vyade Rubadrava Shandi, Haktavikamshaja Pakwalinga. All the symptoms start reduces gradually. That is Vedana Upashanti, and the redness is changed to light pallor or brown color. Pandu Varna, that the redness will slightly reduce to the Pandu Varna, and the swelling becomes reducing in size, and the skin will be wrinkling. There will be wrinkling of the skin, and fluctuation test will be positive. That is mentioned as Nimna Darshana Mangulya Avapidide Pratyunamanam. While pressing with the fingers, that will move upwards, and Basta Viva Udaga Sanjaranam. By pressing on this spelling, there will be movement of the fluid in between these fingers. That is, fluid test will be, then the fluctuation test will be positive here, and surgeon can feel the thrill of the fluid. Or first by applying pressure and counter pressure alternately in both the sides. Other symptoms like occasional pricking, and there will be itching sensation in the margins, and the appearance of elevated point of pus, and the absence of complications, and liking towards the foods are present. That is, the appetite is generated again here. And in brief, symptoms will be mild in Amavastha and highly exaggerated in the Pachyamanavastha, and gradually that will come down in Pakvavastha. Once the inflammation is converted into abscess, that is called Vidradi in Ayurveda, and it is treated as a separate disease. And if one Vaidya is able to recognize all the three stages clearly, he can be called as physician. Otherwise, they are Taskara Vaidyas. And next is about a dosha involvement in Vrinashobha. Badadride nasti rucha, the pakaha pittadride, nasti kabhashcha puyaha, tasmat samastat paripaga kale, pajanti shobham streva dosha. That is, without pain, without vada there will be no pain, and without pitta there will be no paga, and without kapha there will be no puya. Hence, during the paka avastha of the shobha, all these diseases are involved. Next, moving on to the Chikilsa. Adu Vimlapanam Kurya. That is, this is one of the most important point. That is Saptobakrama of the Vrinashobha. Adu Vimlapanam Kurya. Dvidiyam Avasechanam. Tritiyam Upanaham tu. Chaturthi Padanakriya. Panchamam Shodhanam Kurya. Shashtam Robana Vishide. Ede Krama Vrinasyoktam. Saptamam Vaigradapaham. That is, first one is Vimlapanam. That is light massage or rubbing to increase the circulation. That is Vimlapanam that can be done with finger or venu, nali, etc. And this light massage or rubbing is done to improve the blood circulation. That will be done in Amavastha itself. Next is Avasejanam. That is elimination therapy, including bloodletting for the removal of the toxin. We can consider this as Avasejana, that is considered as the evacuation of the doshas or elimination of the doshas, or the Parishega, that can also be thing in this case. Next is Upanaham. Upanaha, that means warm pouties for the subsiding the Shobha in the Amavastha itself. Next is Padana. Padana, Shodhana, etc. can be done in after Pakavastha. Padana, that is cutting or incising. That is different types of Shastra Karmas are used for Padana. And next is Shodhana, cleaning procedures are mentioned, and Ropana, healing therapy, and Vaikritapaha, that is removing or warding off the abnormality, that is returning or restoring the normalcy of the scar of the vrina. Next is avatarpanam eva adi upakrama. Avatarpanam adi upakramaha esha sarvashobhanam samanyam pradhanatamasya. That is, avatarpana is the first line of the treatment, and it is common for all the swellings, and it is a very best treatment for the shobha. Similarly, alepa adya upakrama esha sarvashobhanam samanyam pradhanatamasya. This is mentioned in Sushruta Sutra, 18th chapter. That is applying the drug as a paste form. That is alepa is the first treatment, and it can be used in the swellings, and it is also a very important one. Next is Shadvidaha Prag Upadishta Shobha Tasya Egadasha Upakrama Bhavanti Avatarpanadeyo Virejanantaha. That is, it is mentioned in Sushruta Samhita Chikitsa Sthana Duvraniya Adhyaya. The treatment starting from Apatarpana to Virejana, that can be beneficial to mitigating the Shobha, Vrana Shobha. These 12 therapies are mentioned for Vrana Shobha Chikitsa. They are Apatarpana, Aleba, that is Apatarpana means fasting or Langhana, and Aleba, you all know that Aleba. Parishega means irrigating or spraying or pouring the liquids. Apinga, Sweda, Vimlapana, Upanaha, Pachana, Vistravana, Sneha, Vamana, Virechana. These are useful to mitigate the Shobha. This swelling does not subside even after the proper treatment. It should be understood that it is going to ripen quickly. That will move on to the Paka Avastha. While doing, if it move to the Paka Avastha, then we can adopt the Shastra Karma. Before doing the Purva Upacharam, some procedures are mentioned by Acharya Sushruta in that chapter. Ama Pakveshaniya itself. They are Prak Shastra Karmana Cheshtam Koje Raduram Hishak Madhyabam Paye Madhyam Tishnamyo Vedanasaha. That is, before the surgical procedure, the patient should take the favorable food. If they are addicted to madhya and they are intolerant to pain, they can use strong wines. And we can see what are the benefits of these. Anna Samyoga, there will be no mursha, and use of madhya, shastramna, buddhyade. And we can see some of the common yogas used in the Vrana Shobha. That is Nimbadi Kashaya, Aragvadadi Kashaya, Mahamanjishtadi Kashaya, Gugulu Tittagam, Gugulu Panchapala Churnam, Kaishora Gugulu, and Triphala Gugulu. And some of the complications are mentioned if there is no proper treatment for the Vrana Shobha. They are, in case of Ama Chedana, there will be Adimatra Vyapatana of the Mamsa, Sira, Snayu, Sandhi, and Asti. There will be Shonida Adipravarti, Vedana, Avadarana, and Sheda. This is one of the entrance point. Ama Chedana of the Vrana Shobha. This will cause Sheda. And if there is, if a Shobha is found to be Paga, there is Upeksha of the Pakka Vrana Shobha, then it will lead to Nadi Vranam, and the prognosis of that Nadi Vranam will be Krichrasadhya or Asadhya. That's all about the Vrana Shobha. Thank you.